Our next speaker is Dr. Aditi Roy, and she is, I am very proud to introduce her. She is a research scientist at Center for Environmental Health, Public Health Foundation of India. She has been trained in India and the US and have worked in India, Uruguay, and with minority populations in the US. And her main interest of broad research lies in understanding how our environment, including pollution, nutrition, diet, and social surroundings, can impact health and disease development through a life course approach. And she has got massive training in nutrition, epidemiology, environmental health, maternal and child health, and she is working towards bridging the interdisciplinary boundaries, encouraging cross-learning, and bringing the seemingly disjoint disciplines together for better understanding of well-being and disease development. So with this introduction, I introduce Dr. Aditi, and I invite her to deliver her talk.
Thank you so much. Am I audible to everyone?
Yes, very well.
Okay. Thank you for the very kind introduction, and thank you to Dr. Ramani and to everyone for giving me this opportunity to talk in this platform. I'm not a clinician, so I'm very excited to talk, present this to the clinicians. My topic today is chemical toxins and health effects. Before I do that, I think the broad aspect of our session was developmental origin of health and diseases, and really how we think about in terms of environmental influences in this paradigm. So I think we all know that this wonderful concept or the model of developmental origin of health and disease, or as we call DOHAD, is being proposed by David Barker in the UK in the 80s and 90s, where he proposed that the adult chronic diseases that we see from cardiovascular disease to diabetes are probably potentially programmed during pregnancy or in early infancy. It's a profound model, and I think now more and more people are encouraging this model and trying to test hypotheses around this model. So when Barker proposed this model, he tested a lot of studies, did a lot of studies in the UK and all over the world, including in India, and it was focused mostly on maternal undernutrition and this pathway of how a malnourished mother can affect the fetal growth and low birth weight and preterm birth, and which in terms increases the risk of metabolic syndrome, as we call it, the high blood pressure, high cholesterol, and a high blood sugar, which is a risk factor we know for later life cardiovascular disease like coronary heart disease. So this has been mainly the very nutrition focus in the DOHAD paradigm. But more and more we see that people realize it's not the nutrition, it's everything that everyone is exposed, including the pregnant women. But there is evidence existed for environmental exposure as well, and that comes from diethyl stilbestrol. If you remember that. Estrogen-like hormones, the metal, lead, or even alcohol and smoking. I believe that at the beginning it was talked about that how smoking really increases the risk of preterm birth and low birth weight. And the heart of this DOHAD is really this concept of epigenetics, which is the genetic modification and adding of chemical compounds, but without really changing the genetic sequence or the gene structure. So I think this sort of this model holds what we are trying to study today, even when we talk about the environmental influences during pregnancy and very early life. So going back to my main topic, which is the chemicals and toxins, it's so we are surrounded by chemicals. Like we can't really escape this. If you are an agricultural farmer, if you are more vulnerable, you are actually applying pesticides at the ground. So you are either mixing or spraying. So mostly we know that our agrarian women community are, or the occupation is very much women led, so there is exposure there. If even you are not, you are exposed through residues in food. Then we live in a mosquito-prone zone, so DDT is being used for vector-borne diseases. Then we have a host of problems with our waste management, and I think previous speakers have alluded to this point about how our water and air is polluted because how we improperly manage our waste. And this picture is actually from electronic waste, which is a very growing problem. And again, the main workforce is actually women-led. So what happens to those women during pregnancy and children, the most vulnerable, I think, is something to study for, something to advocate for a better management of these wastes. And then in everyday life, regardless of what socioeconomic status you're coming from, we have a problem with our plastic chemicals. Everywhere, everything that we use has the chemicals in it. Now, the problem is not that we have chemicals. I think in some cases, we really sometimes do need them. But the problem is that we don't know how many of chemicals are there in the market. And the US has done some inventories, and we see that it's a wide range of 25,000 to 84,000 chemicals are produced and are in the market. But what's more scary is that we don't know the toxicities of many of these chemicals, because first of all, it falls on the industry to prove that they're toxic or not. And most of the time is our animal studies that are being done. So we don't know what is the effect on humans. So there's a various range of chemicals, but because chemicals is basically any substance with matter. But what we are currently talking about is the one that harms us. So the toxins. So that can be industrial chemicals, pesticides, chemicals in plastics and everyday use products, such as we use powder, shampoo, soap, cosmetics, any of it. And metals is also included in all of this, because that is also a chemical. So I just wanted to show this. I think previous speaker alluded to this, but I wanted to again show this. This reminds us of this styrene gas leak that happened within a few days before. It's a scary reminder of our Bhopal gas tragedy, but Bhopal gas tragedy was a pesticide factory. So in a way, a little bit less scary in this case, but nevertheless, it is a scary visual. And we saw the acute poisoning effects. We don't know what are the long-term effects of these gas leak within the communities that were living nearby. So if I have to broadly talk about the chemicals, I will divide it into, so depending on what profession you are coming in, what subject area you are coming in. Sorry, there was some background noise. Sorry about that. But from the environmental background, what we really are concerned about is the persistent and non-persistent. So when we say persistent, is the chemicals when they are introduced into the environment, how long they are staying in the environment. And the chemicals that stay long in the environment are persistent, and those who are degrade quite quickly would be considered as non-persistent. Now, they can be organic or inorganic. And when I'm talking about organic, I'm not saying the organic food, but I'm talking about organic in terms of their structure. So carbon, being in having carbon molecules or not. Basically, okay, sorry. So the organic persistent pollutants are the one that we are very worried about. So that includes most of the pesticides, the organochlorine pesticides, and also the other industrial chemicals that are routinely used in different products that we use. But there are inorganic chemicals, persistent chemicals like metals. But the non-persistent ones are not that it's not bad. They are also bad. It's just that they're maybe less bad. So I just wanted to give you some very brief introduction into why we are really worried about these chemicals, and whether or not we can really see them or measure them in the human samples. So unfortunately, I don't have any Indian data to provide, but I have a study to show that's being done in Canada, which is called the Maternal and Infant Research on Environmental Chemicals. It's a pregnancy cohort in different parts of Canada and recruited about 2,000 women. And they looked at the maternal biological samples from blood, urine, and other samples that are collected from the first trimester of pregnancy. And they looked for over 80 chemicals. And this graph shows you what are the chemicals these women are really exposed to. And what you see is that on your y-axis is that how much of these, in how many samples these were detected. So you can see that this TCA, for example, or BPA, you can say BPA is a plastic chemical we know, whereas TCA is an antibacterial chemical. These legacy OC pesticides are pesticides, the organophosphate pesticides, and then metals and others. They are present in almost over 70 to 100% of the women that were tested for these chemicals. So basically, all of the pregnant women are exposed to this diverse amount of chemicals that's in Canada, but I'm hoping that in most of the countries that will be the picture. So they're not exposed to one chemical to note. So then some authors did another sort of analysis to show what is this pattern that they're exposed to. And what they found that at least in these Canadian women, most of the women showed to be exposed to persistent organic pollutants, which are mostly pesticides and other compounds present in these industrial chemicals, and phthalate. And phthalate is a plastic chemicals. So that is exposed every day. So I don't know whether if we do the similar experiment in India, we would find the similar exposure pattern. But this is what that's in the Canadian women, they found it. And what more worrisome is that this persistent organic pollutants, for example, PCB, has been banned in the world around 1970s. So although it is banned, it still persisted in the environment and the women are exposed. And what I'm going to show in the next slide is that the fetus is exposed. So another study in the US, actually, they looked at the maternal sample and then pair sample, maternal and infant pair samples, and they looked for 59 chemicals in those samples. And what's scary is that half of the maternal samples and half of the fetal samples, which is basically umbilical cord samples, have almost over 20 chemicals that are detected in them. And 8 chemicals, and that includes those persistent organic pollutants that I was talking about, in almost every sample they have looked at. So basically, this proves that these chemicals are getting transferred from the pregnant women to the mother. And it's very important for the policy perspective to present it to the policymakers. The same study actually looked at it, and when they adjusted for lipids, they actually found this lipophilic compounds, which are these PCBs or organochlorines, pesticides, are actually transferred more and found to be higher in the fetus than the mother itself. So the fetus is highly exposed to these chemicals, including mercury, for example. So this is clearly an evidence that mothers are, the transfer from maternal to child is happening. So basically what I'm trying to get at is that other than individual exposure, we are exposed to all of the factors that today we talked about, and we have to look at it together. And that's why the concept of exposome came, and we should look at these factors together to understand pregnancy and child health. So I am not going to go into details of that, but we know that individual chemicals have been associated with many of the child health factors, including child development, child growth, and asthma and other respiratory problems, as well as adult chronic diseases. Not to scare people, health effects are dependent on the dose of exposure, the critical time. First trimester of pregnancy, second trimester of pregnancy are very vulnerable. And even if we don't find an immediate effect right after pregnancy in birth, that doesn't mean that the effects wouldn't be shown in later life. Absence of symptoms doesn't mean that any one particular chemical doesn't have any effect on the child. So for implication, I think what we are doing today is one of the implications of clinical community is that awareness and advocacy. Definitely call for action for the banning of environmental chemicals that have been shown to be very toxic. And I just wanted to mention that there are 28 pesticides that's going to be banned in the coming months. I hope that as a society you advocate for that, because they're really bad. It is important to ask for previous history or being into occupational or other exposure history of the mother and the father actually, and focus on early prevention of adult chronic diseases. I think adoption of DOHA paradigms helps us to prevent disease before it occurs. In terms of policy, we need very strict regulation on chemicals and to protect the most vulnerable, which is the this fetus and the child. We need an integrated approach to prevention. Exposome shows that only banning one chemical would not have much effect unless we look at the holistically all the exposure. And I think what my CV said, and I think I sort of really want to do that, is to bring all stakeholders. So right now, environmental, UN Environment, UNICEF, and all other health agencies work really in silos from the environment agencies. So if we can bring them together and have the talk, then only will be effective in banning or providing regulations in place. So thank you very much.
Thank you, Dr. Aditi.